when the initials of the drug, like aspirin, when we put that, we will have the drop down wherein we will have all the information regarding our product. If the product is in clinical trial, we will have the code for that. If the product is in is a marketed product, we will have a code for that as well. So what is the difference between post marketed product and your clinical trial product is, um, it all has numbers assigned to it. So most of the suspect product will have alphanumerical value by which you can identify the correct investigational product. Now, alphanumerical values are given to the clinical trial product, and the post-marketing products will have the numbers assigned to it. It will not have the alphanumeric, it will have only the numbers. And how any drug is coded is, these drugs are coded. The dictionary assigns a unique alphanumeric code to each drug concept. And I'm going to explain this concept. It's going to be very rare that you will be asked that question, but if you can understand that, because there is a probability, sometimes what happens, you are interviewing for a company, and then the interviewer wants to check your knowledge. So those questions might come from these details, what we, try to teach when we dig deeper and deeper. So what happens? Any drug code, drug dictionary assigns a unique alphanumeric code to each drug, known as WHO drug dictionary. Now this code helps to ensure the unambiguous identification and differentiation of individual drugs. And then you will have the drug names. Drug names, the WHO drug dictionary includes various drug names. It will include the generic, it will have the brand names, it will have the synonyms, international non-proprietary names. Because when you get cases from Europe, which is not in English, which is in French or German, they will have their own names, their own product name, which is not in English. But the WHO drug dictionary even contains those names so that you can code the concomitant medication or your treatment products properly. Because your company product is anyways there in the list. Whatever is not there sometimes becomes a little difficult to code. Otherwise, autoencoders works, everything is there. You just need to code the proper active moiety of the substance of your product, whether it's a clinical trial product or it is a marketed product. Now the question comes is, why do we need to code everything? You know, you can be asked as in the interview as in, why do we even need this WHO drug dictionary or any drug dictionary to code anything? So your answer should be to check for the drug-drug interaction, and also to find if there are some other reasons like drugs might be involved in the happening of the adverse event. So suppose the patient is taking your company product, which is a suspect product, but the patient is also on other concomitant medications and there are treatment given to the patient. So there are chances that when you do the causality assessment, there might be other products which is involved in happening of those adverse events, and your product is actually safe and not related to the adverse event which has happened to the patient. So that is the reason we need to code everything. We need to look for the whole clinical scenario, as in what happened, how it has happened, what all the patient was taking, and then we should go forward and do our assessment. Now, WHO Drug Dictionary, let's talk more about the WHO Drug Dictionary. Is WHO Drug Dictionary, UMC stands for Uppsala Monitoring Committee, which is responsible for updation and maintenance of WHO Drug Dictionary. Like MEDRA, MSSO is responsible for maintaining MEDRA. Likewise, UMC is responsible for updation and maintenance of your WHO Drug Dictionary. And it is a worldwide source of global medicinal information of medicinal products and active ingredients. Um, WHO Drug Dictionary is updated every year. It's very up to date, and it always, whenever you're using the Argus, it auto updates in the system, and there is a timeline for